Think, plan, and consult for your family's future. What a glorious and wonderful day to our dear viewers. I am Malaika Fevi Panya, your host. We, the Group 27, proudly present to you this illuminating webinar entitled Sabi po, Debunking Myths and Misconceptions in Family Planning. Before we start with the proper discussion, allow me to introduce to you our speakers, starting off with Mr. Paul Jello A. Uwano and Miss Shikaina Maranga. And without further ado, let the first speaker take it away.
Hello, everyone. I am Shikaina Aquino Maranga, and to start our discussion, let us begin by defining and understanding what family planning is. According to the Philippine Department of Health, family planning is having the desired number of children and when you want to have children by using safe and effective modern methods. Proper birth spacing is having children 3 to 5 years apart, which is best for the health of the mother, her child, and the family. To elaborate, family planning is a way for people to ensure that the size of their family is within what they want and what they can sustain. Family planning also gives people the opportunity to decide when they would want to have a baby and how many of them they would want to have. You know, growing a family is no easy task, and there are several factors that one must consider before forming one. We have to take into consideration our financial capability, emotional maturity, our health, and we must take into account how big of a responsibility it is to have children. Let us keep in mind that procreation in its very essence does not only mean to bring forth a child into this world, but its scope includes loving, nurturing the child, and assuming parental responsibilities. That is to provide its basic needs such as shelter, clothing, food, and especially education.
That is right. Now, you already have sufficient knowledge and information about what family planning is. But what should we know more about family planning? By the way, I am Paul Jello A. Owano. We'll be discussing the importance of family planning. Family planning is more than just controlling the number of children a couple can have. Family planning protects couples and individuals and their well-being in essential ways, such as first, pregnancy complications can be minimized. It protects the woman from health risks that may occur before, during, or after childbirth. A study showed that women who bear more than 4 children are more at risk for maternal mortality, which is why there is a need to plan thoroughly. Women 35 years older are vulnerable to developing conditions, and they should be protected as well. Family planning also reduces incidences of unsafe abortion, as unwanted pregnancies due to lack of planning is also prevented. Adolescent pregnancy can also be reduced. Teenagers are prone to giving birth to preterm babies and have higher rates of neonatal mortality. Contraception protects teenagers from the physical, emotional, and financial burden of unplanned pregnancy. Family planning also cuts down infant mortality rates in relation to a result of unwanted pregnancy being prevented as well. Sexually transmitted infections or STIs can also be prevented, especially with the use of certain methods such as the barrier method, with condom as a perfect example. And lastly, family planning can help the people in decision making with regards to forming a family. Through proper spacing of pregnancies, building financial security, and grabbing opportunities in life, other than creating a family such as education and career, will never be out of reach. So, better take note of the importance of family planning. You might consider it soon when the time is right. But you might ask, in what ways can family planning be done in controlling the expansion of a family or properly spacing pregnancies? Ask no more, as we will be now discussing the methods of family planning.
Methods of family planning involve the use of birth control techniques and procedures which come in various forms. We have four broad groups of contraceptive methods. We have the natural, barrier, hormonal, and surgical methods. Under these four classifications are much more specific types of contraceptives that we could choose from. Although there are all sorts of contraceptive methods available, they all share the same goal, and that is to prevent pregnancy, to allow a woman to put off getting pregnant until the time she decides to want to have a child. So, this is how normal pregnancy occurs. The sperm goes into the vagina, swims through the cervical canal, and then goes upwards to the uterus. It then travels through one of the fallopian tubes. If an egg is, if an egg is released into the tube during that month's ovulation, then a sperm now has a chance to fertilize it. These contraceptive methods work in preventing pregnancy in three ways. It could either block the sperm, disable sperm, or suppress ovulation. Now we will have a gist of these methods in the next few slides.
Now that we have introduced to you the overview of what are the methods of family planning, let us take you deeper, starting off with the first method. The first method of family planning is the natural way along with fertility awareness method. These are all free from introducing a foreign substance or chemical to the user's body. With an effectivity rate of 100%, abstinence or refraining from sexual intercourse fits in this method. We also have lactation amenorrhea method for breastfeeding mothers, as breastfeeding naturally suppresses ovulation and menstruation. We have coitus interruptus for men. One of the male responsibility methods is the withdrawal of the penis just before ejaculation. Fertility awareness method, on the other hand, is the detection of the signs that a woman has when she is fertile, so she and her partner can avoid having sexual activities in that time. It may be guided using the calendar method with a calculation based on a set formula. Cycle beads, a visual method usually for those who have menstrual cycles between 26 and 32 days. We also have basal body temperature, measuring the woman's body temperature on the same time every morning as the woman's body temperature rises during ovulation. Billings method for cervical mucus, symptothermal method, among others.
Next, we have the barrier method. Barrier methods of contraception are forms of birth control that blocks the sperm from reaching and fertilizing an ovum. This type of contraception may come in the form of spermicide, which by its name means it kills a sperm. We also have a male and female condoms. A male condom is a latex rubber or synthetic sheath that is placed over the erect penis before coitus to trap sperm, while the female condom is similar to that of the males. It also prevents the sperm from meeting the egg, and both offer protection against contracting sexually transmitted diseases such as gonorrhea, chlamydia, and HIV. Next, we have diaphragms and cervical caps. Both are dome-shaped and are made of silicone and are placed inside the vagina to cover up the cervix. Next, we have the hormonal contraceptives. As its name implies, hormonal contraceptives such as oral contraceptives, patches, rings, injectables, and IUDs contain hormones, namely estrogen and progesterone, which its main action is to either suppress the release of eggs from the ovaries, thin the uterine lining, or thicken the mucus in the cervix. This way, sperm won't be able to fertilize an egg, thus preventing pregnancy from taking place.
Okay, now we are down to our last method, which is the surgical method. Surgical methods of family planning are usually permanent and are not recommended for those who want to have children in the future. We have tubal ligation for women, which involves cauterizing, tying, or banding of the fallopian tubes. Vasectomy is for men, where the vas deferens in which the sperm travels is cut and tied or cauterized to prevent the sperm from exiting, preventing fertilization to happen.
All right, that is all the general information for the methods of family planning. But Paul, despite this, there are still several false claims regarding these methods, especially in the context of family planning.
Yes, Shekinah. That is why we will now discuss some of these relevant myths and misconceptions in family planning. And together we will fight them with facts.
The prevalence of myths and misconceptions regarding family planning continues to be rampant. False information spreads around in a very exaggerated and erroneous manner. And so, at this juncture, we are going to tackle the highlight of this webinar, debunking the
Bunking the
myths
myths and
and
misconceptions
misconceptions of
of
family
family
planning.
planning.
The first myth we have says that long-term use of family planning methods will cause infertility or pagkabao. This is not true because once you stop taking those contraceptives, your body will regain its normal cycle and its ability to get pregnant depending on the range of effectiveness of your chosen method. Well, of course, if a man or woman chose to undergo sterilization process, that one is permanent and irreversible. So they must be aware that they won't get pregnant or get someone pregnant when they decide to have this method. When the body is no longer being tricked by the hormones from birth control, it resumes ovulating. Most women's cycles will return to normal within 3 months of discontinuing hormonal birth control, but it may take a little longer for others. There may be a short term fertility delay of 2 to 6 months after a person comes off of oral contraceptives. It is important to remember that age plays a huge factor with regards to fertility, as the number of eggs a woman has is finite, and quality may even diminish when she gets older. Aside from that, there also are a whole lot of underlying fertility issues that may exist during this time. And with many women deciding to delay pregnancy until later in life, they must be aware of these factors.
Myth debunk.
Okay, so proceeding to our next myth, we have family planning is expensive. As we have discussed earlier, there are quite a number of methods that can be used in family planning. And fortunately, most of these are reasonably priced and are available over the counter. There are companies that provide family planning supplies to their employees. PhilHealth covers the costs of family planning counseling, IUD and IUD insertion, bilateral tubal ligation, vasectomy, injectable, and the initial cycle of progestin-only pills. And we also have the Republic Act 10354, also known as the Responsible Parenthood and Reproductive Health Act of 2012, which says that, and I quote, the state shall promote and provide information and access without bias to all methods of family planning, including effective natural and modern methods which have been proven medically safe, legal, non-abortifacient, and effective in accordance with scientific and evidence-based medical research standards, such as those registered and approved by the FDA for the poor and marginalized. End of quote. This law guarantees universal and free access to nearly all modern contraceptives at government health centers for all citizens, including impoverished communities. In addition, the law requires reproductive health education in public schools. Although abortion is recognized as illegal and punishable by law, this act still acknowledges the woman's right to post abortion care and must be treated and counseled in a humane, non judgmental, and compassionate manner.
Myth debunk.
Okay, so two misinformations have already been debunked. Let us explore more with our third one. Family planning has negative effects on sexual desire and performance. Sex drive or libido actually depends on each individual and it is affected by several circumstances such as abuse of alcohol and drugs, anxiety, stress, depression, and an illness, among others. Sex drive is more than just hormones. The person, the place, and time also matter. The Department of Health clearly stated that family planning or using contraceptives do not affect an individual's sexual desire since it varies from person to person. In fact, it actually frees the fear or worry of unwanted pregnancies, which will actually add enjoyment and it enhances the sexual relationship between you and your partner.
Myth debunked.
Our fourth one, we have family planning is a form of abortion. The Philippine laws say regarding abortion is, of course, it is considered illegal. In family planning, contraceptives are a way of prevention and not termination of pregnancy. Birth control is preventing pregnancy from happening, while abortion is stopping an existing pregnancy. Abortion is a medical procedure done after three things: fertilization, implantation of embryo into the uterus, and the release of the human chorionic gonadotropin or HCG, a hormone that confirms positive pregnancy test results. Family planning actually helps a woman from getting an unintentional pregnancy and thus reduces the occurrence of abortion. In fact, the Food and Drug Administration released at least 51 contraceptives that are considered safe and non-abortifacient in the Philippines last 2017, paving the way for effective implementation of the key measures of reproductive health law. The list includes progestin subdermal implant as among the forms of contraceptive products that are non-abortifacient, together with Implanon, injectables like Protec, and IUDs like Mirena.
Myth debunked.
Okay, proceeding now to our fifth myth. This says that mandatory sex education and contraceptives will destroy the family, compromise morality, increase promiscuity, and HIV infections. As a child hits puberty, a lot of changes happen. These young adults mature physically and emotionally and become curious about their body, about relationships, and inevitably about intercourse. When this time comes, you would want to be sure that the information that these young adults are absorbing are factually correct and that they are guided appropriately to ensure that the risks involved in this matter are minimized. Age-appropriate sex education actually provides children the knowledge, understanding, and awareness with regards to the risks of sexual and reproductive health. Proper sex education empowers young people to create informed decisions about relationships and sexuality, as well as it protects them from being vulnerable to harmful sexual behaviors and sexual exploitation.
Myth debunked.
All right, we have already discussed half of our misinformations regarding family planning. Let's proceed with our sixth one. You can't get pregnant if your partner withdraws just before ejaculation during sexual intercourse. Is this really true? Coitus interruptus, or also known as withdrawal, is an old tradition of birth control. However, it is not 100% effective of all the time. Some pre-ejaculate are also known as pre-cum that acts as natural lubrication during sexual intercourse does not have sperm itself, but sperm can leak as it travels to the urethra and may be released just before the man goes into climax. It only works 78% of the time, which means that using this method for over a year, 22 out of 100 or 1 in 5 women would get pregnant. However, it is better to perform this than do nothing. Okay, so
Myth
now
debunked.
proceeding to our seventh one, we have you can't get pregnant if you had sex during a woman's period. This is a common belief that sex during menstruation is considered safe and does not result to pregnancy. This is not true at all. Ovulation may still occur earlier than expected. Additionally, bleeding might be mistakenly understood as the beginning of menses, but could be a sign of ovulation, a time when the woman is most fertile. Further, sperm can survive up to 72 hours inside the woman's reproductive tract, which puts a higher possibility of pregnancy, especially during the end days of a woman's period. Moreover, another worry in sex during period is the risk of passing on sexually transmitted infections such as HIV or hepatitis, as these viruses live in blood and menstrual blood can get infected with this and spreading may occur.
Myth debunk.
Okay, proceeding now with our eighth myth. This says that contraceptive pills can get absorbed into the wrong part of the body. This is not true because when we swallow birth control pills, what happens is that it travels down to our digestive tract and it then dissolves in the intestines and gets absorbed into the bloodstream. Its contraceptive action will then take effect, and then afterwards, it will be metabolized in the liver and get eliminated from the body.
Myth debunk.
Okay, let's move on with our ninth myth. This says that I won't get pregnant if I take a shower or bath right after sex, or if I urinate right after sex. First of all, taking a shower or bath right after sexual intercourse only cleans the outer portion of the body, and the sperm inside won't get affected at all. Second, urinating after sex still does not prevent pregnancy. Why? Simply because of our anatomy. The passage of urine is different from the path a sperm would take to get someone pregnant. So, peeing after sexual intercourse does not push sperm out of the vagina after ejaculation. And you may wonder, what about douching? Is it effective to avoid getting pregnant? The answer is still no. Sperm swim very fast at about approximately 5 millimeters per minute and can reach the uterine tubes within minutes. So by the time a woman douches, sperms have already traveled up the uterus, and douching can even support sperm transport as it can push it upwards. So, if a woman engages in an unprotected sexual intercourse, which means that she is not using any contraceptive methods, then there is a high chance that she is likely to get pregnant.
Myth debunk.
Yes, good job. You have stayed with us until the ninth misinformation. Stay tuned as there's more to talk about. And now we are down to our last misinformation regarding family planning. Our 10th one, pills make a woman gain weight. It is actually very rare, but some can gain weight when using pills, but it is just a temporary side effect due to fluid retention. And not to worry, it's not because of extra fat. 44 conducted studies revealed that there is no evidence that contraceptive pills make most women gain weight. As a side effect, it typically only lasts for 2 to 3 months. If you are significantly gaining weight, talk to your prescribing doctor as he or she will recommend you other pills. There are two types of contraceptive pills, one that contains both estrogen and progestin, and the other containing progestin only. Today's pills are different since in the 1960s, high levels of estrogen were shown to cause weight gain due to increased appetite and fluid retention. Newer generation of contraceptive pills now only cause lesser side effects.
Myth debunk.
All right, well, that was a very informative discussion over there. But it's not yet over. For our last coverage, we will give you a glimpse of the existing law and program in the Philippines regarding family planning. Here's Mr. Paul Juano once again.
You think we're already done discussing? Not yet, as we will be now discussing the law and the program in the Philippines about family planning. Now that we are done debunking those myths and misconceptions and fighting those with facts, I will briefly discuss the law and program that the Philippines have in addressing the issue in family planning. First off, we have the Responsible Parenthood and Reproductive Health Law, or also known as the Republic Act 10354 of 2012. It mandates the government to address the needs of Filipinos on responsible parenthood and reproductive health. It upholds the principle of the right to make free and informed decisions, especially couples, adult individuals, women, and adolescents, inclusive of preferences of family planning methods and family size. Provision of effective and quality reproductive healthcare services, truthful information and education, and preferential access to the poor and marginalized. Its benefits include improved PhilHealth coverage on reproductive health services, ensured supply of reproductive health commodities, and development of age and developmentally appropriate education services. Not just that, the Department of Health also initiated the National Family Planning Program spanning from 2017 to 2020 to track the changes in response to several interventions. Its goal is to provide modern contraception to 3,789,032 women of reproductive age. Its two strategies include family planning outreach missions and postpartum family planning services. It targets leadership and management, such as establishing family planning units and enhancing systems, supportive environment, including contraceptive security, family planning grants, nurses deployment program, and field health. Also, it targets in reducing the fear of contraceptives through effective messages and communication strategies under social marketing. So, yes, those are just an overview of how the Philippines promote healthy family planning nationwide. If you want to read more and dive deeper, just visit the Department of Health website on www.doh.gov.ph and you will find more information and enlightenment regarding health concerns in family planning.
Wow, that was indeed enlightening. We started with discussing what family planning is and enumerated its importance. We also have tackled the methods used to implement family planning and then corrected the myths and misconceptions that surround family planning.
That's right. I do agree with you about how this webinar has been giving information from the start. Methods of family planning were also talked through. And then there goes the highlight of this webinar in fighting misinformation in family planning.
Point well taken. I am looking forward to the fact that we have instilled the key points regarding this topic because reproductive life planning is highly essential to ensure that an individual or couple is ready to bear responsibility for a life they are about to create, to protect women from health risks that may occur before, during, or after childbirth, and to make certain that individuals or couples will be able to avoid short and long-term consequences of unintended pregnancies.
The methods of family planning are tools in which one can utilize to avoid pregnancy unexpectedly. It is important to note that the efficacy of these contraceptive methods vary and that in choosing a method to take, they must consider their personal values, ability to use a method correctly, if the method will affect sexual enjoyment, financial factors, if a couple's relationship is short or long term, prior experiences with contraception, and future plans.
Our host was right from the start. Think, plan, and consult for your family's future. We hope that you have gained important lessons and insights from this webinar and thereby save us from making maling akalas or misconceptions and myths that surround family planning.
We are very much delighted that we have imparted our knowledge in disproving the myths and misconceptions regarding family planning. Tandaan na wag maniwala sa chismis. Kung may narinig na di ka panipaniwala, i-fact check agad. Kumonsulta at huwag mahiyang magtanong.
Huwag magpadala sa mga marites makinig sa mga eksperto at kwalipikadong profesional. Maling chismis ay iwasan.
I couldn't agree more. Thank you so much for staying with us up to this time. Once again, I am Paul Jello A. Owano.
And I am Shekinah Aquino Maranga, fight the misinformation regarding family planning. Thanks to all of you. Bye!